But it is so satisfying to just realize that today I have helped these many people. I have relieved these many people's pain, physical pain, and I have probably just healed these many lives. This feeling is unparalleled. It just cannot be matched. Hi everyone, my name is Dr. Ashwini Priyadarshini Singh. I graduated from Army College of Medical Sciences and I'm currently working with the Delhi government. I just came back from a night duty, so I thought that this is the right time and I feel so inspired with what I do. So I just thought that this is the right time to make this video. When Target Medical contacted me and asked me that they want me to guide UG students, I was really filled with a lot of happiness because I have been guiding a lot of students through my Instagram page and motivating them to take up this career and telling them the real and the raw reality of being a doctor in a country like ours. But obviously, you can anytime diversify. You can go into whatever you can do whatever your mind wants. But to begin with, as to whether you should to start with what how my journey has been, I'm going to keep it very candid. There is not a script at all. Obviously, this is not a practiced interview, but I saw a few videos on Target Medical. I am not going to mock this one, but the doctors that I see there are like really serious people, and if you go to a doctor, they're very serious and all. So not all doctors are like that, and I'm sure you find the doctor who inspires you. I found mine when I was in 6th standard. I would like to name his name was Dr. Murugappa Chinnavirappa Modi. He was an eye surgeon who used to do a record-breaking number of cataract surgeries completely free of cost in South India in blindness camps. And he was a doctor who inspired me to selflessly, who basically instilled the idea of selflessness. So I thought when I was in my 12th, I thought that what is this one profession which will, make me have a living, and also is something which will help me help people in my own capabilities as much as I can. So the first thing which striked was becoming an IAS officer. So to be very honest, I'm going to be brutally honest here because I don't want to be like a very curated sort of a video that I'm making and I'm telling you stuff because I've read it so much and I've seen it so much. I'm going to tell you about my very personal journey, how it has been for me to come till here and how it was, what all challenges I faced, because no one wants to tell you about the shortcomings and the ugly side of whatever profession that they are in. But me, a doctor right now, even when I want inspiration or I need guidance, so many specialist doctors who are there on YouTube, I just go, I watch a video and it just puts so many things into perspective. So I think I want to be that for you guys. First of all, congratulations that if you have ticked on this particular video and you're here for some inspiration. I congratulate you for having compassion towards mankind. I congratulate you for thinking that you want to become a doctor because obviously you want to help people. So let's start with when I was not Dr. Ashwini and I was Ashwini. As I told you, I never wanted to be a doctor, but somehow I ended up in the bio section of my school. I did not go for coaching in my 11th and 12th because I come from a army background, and hence we never had like a very stable sort of a stay. And at that time, my school and where we were, they did not have very good coaching facilities and stuff. So I could not really get that sort of a formal coaching. But I attended my lectures very diligently. I wouldn't lie. I was very studious, 11th and 12th. I used to carry my books in the school bus. I did not used to waste even a single second, and I used to keep on reading. And that's basically me in my 11th and 12th. And then I finally decided, okay, probably this is the career for me. So I did. I fared well for the first time when I appeared for my entrances. I fared well in my exam, but obviously I did not get the city I wanted to go to. Everyone wants to study in a first tier city. I don't have even a single biology graduate in my entire family tree for that matter. But I'm the ever first doctor, ever first bio student, ever first whatever you want to say as far as medicine biology goes. So I did not have anyone to guide me, but I knew that I need to, move out from a small town because I have always been a small town girl and then want to go to a first tier city and study. So then I dropped and I took coaching from Akash Institute. Ideally, since Akash did give me power to fuel my dreams, I would say that there are a lot of better options right now, I think which you guys should explore. And then you should see for yourself. Please don't go for the brand value. You should do the background research before getting yourself enrolled in a coaching institute, because it can make and break things for you. Honestly, I did not like Akash very much. They were just making us cram, and probably the faculty that I got was not very great. But I would not exactly like to name the center, but few Akash centers are good, but the one which I went to was not that great. I got a scholarship there because of my previous PMT rank, and it was barely peanuts for me to study there at Akash. After that, I cracked and during my time, I gave my exam in 2015, and in 2015, right 1 year before that, there was NEET, and then they again cancelled it. Then they again put it in the AIPMT form, and then in my time it was AIPMT, and then from the year next they decided to start off with NEET again. So the disadvantage of having AIPMT was that I had to separately study for autonomous institutes like Puducherry, like Jipmer in Puducherry and AIMS, and obviously for the state entrances that I was eligible for, and obviously the central entrance. So that made my task way tougher. But the good side of this was that it was if you messed up on that one day, you could probably just pick up in one of the exams and get it. So what basically happened was that my 1 year of drop was not easy for me. Trust me, it was hours of studying every day, going to my coaching institute. I developed a lot of anxiety issues. I used to have bowel disturbances. I was perpetually sad, and there was always this sense of doubt that I developed in myself. Like, say I would regularly give my mock exams, and if I did not do well even in one of them, I would just sink in self-doubt as to, okay, I probably do not have the salt to crack and go in a first tier city. But at that time, there is this one thing that I would like to tell you guys. In whatever you do in your life, regardless, may it be a medical entrance, life itself is an exam, but pertaining to just this, what happens, whatever the result is going to be, is not something which is in your control. And there is no point harping and getting anxious about what the result is going to be. But you should honestly and with all dedication do what is in your control. Because after the result, you should not have this regret that you did not prepare as much. It's not even about those 3 hours. You cannot regret not performing or being sleepy or having a panic attack. These things come and go. But the point is, all this 1 year before that, or all that preparatory phase, did you give your best? Is it enough that tomorrow you can look yourself in the mirror and say, okay, I tried my best in whatever capacity? Someone is not able to study 18 hours a day, at least give it 8. If you're not studying to 8, at least give it 5. I mean, you should be just true to yourself. You should be just true to the cause that you have picked up. And I think that is something, which really kept me going. Every time I would perform poorly in an exam, I would tell myself, okay, I'll just, pull it up in the next. I will up my game. And performing badly was earlier used to be a trigger to put me into self-doubt, and that spiral down cycle of a lot of self-doubt, and then anxiety and sadness used to start. But eventually, as the exam date approached, that became a trigger to work even harder. Because my cause was true, that I wanted to do it not just for the sake of it. I wanted to do it because I really wanted to be in a profession that helps people. I wanted to heal people. So and then faring well in an exam was again it was a win-win situation for me. If I did well, I would be confident about the topics that I've covered in that particular exam, and secondly, I would very feel good about myself, and that would again fuel me to study more and do more tests and all that. So this is how you basically bend your reality. Your mind at this time is your biggest enemy. There is not even there is no pill, there is no one solution to this. It is just your thoughts who are going to daunt you and haunt you and make you slow down. But you have to at that time realize now that there is such explosion of information. There is information available everywhere. Don't rely on XYZ resources. Don't listen to high-flying toppers and listen to them and let them tell you that you have to study these many hours a day. No. Everyone's study pattern, everyone's capacity, everyone's output is different. Okay? And you are going to curate your study plan according to your productivity. Not the number of hours that you give to that particular topic or to that particular subject. It's going to be on your productivity, it's going to be on your performance. And beyond that, this is the time when you have to be your best friend, because your mind is going to be a big enemy of yours. So as I recently cleared my NEET PG entrance, so I will be starting with my MD soon. So even at that time, it was, trust me guys, I mean that preparatory phase of NEET UG is the most difficult time that you will face for this journey. This is doing an MBBS. I'm not going to say that it's going to be easy, but it is nothing as compared to what you guys are right now going through. I mean, hats off to all of you for bearing that and having this kind of perseverance and that kind of motivation to go ahead. So as I was telling you, when I was studying for these entrances also, since it was sitting for an entrance exam for almost after 5.5 years, it was a complete flashback of my NEET UG preparatory days. And then I one day sat down and I wrote down the things that I used to tell myself and how I used to study and all, and it really helped. So if you think, say, worst case scenario, you don't get a seat. This particular effort that you have put and all that knowledge that you have acquired, it's not going to go waste. Everything that you read, every study plan that you make, every philosophy that you read, every motivational quote that you read, every video that you see, it is going to benefit you in the long run in whatever you do. So this entire thing is not going to be a waste, because this is one thing which scares us a lot, that this period is a waste if it doesn't materialize into us getting the seat of our choice. But this is not the thing. It's so much less about the destination but so much more about the journey. This profession is all about perseverance and patience. If you are not patient, then you're not getting there. So this was all about it. I used to regularly take mock tests. This is something that I realized during my PG preparation also, that you guys should take mock tests as many as possible, so that you know your weaknesses, you know your strengths. You should time yourself, because it's a competition. It's not a subjective exam. It's a competition, and you where you get depends on how others have done in that exam. It doesn't matter how many hours you've studied. It doesn't matter, and nothing matters. So you have to make yourself the best. You have to prepare yourself, but don't go into the cycle of self-loathe, and don't just make it a make or break thing in your life. It is just another thing which you have to do in your life. It is not the end. There are a lot of things which you guys can do, and there are a lot of places which you guys can go if not this. I get so many texts on my Instagram DMs from so many aspirants that, ma'am, we've been trying for these many years and we've still not made it. And then I ask them that, do you really want to be a doctor? Is that exactly what you want to do? Because honestly, when I started studying to be a doctor, to be honest, when I started preparing to be one, I did not actually know what goes on in the day of a doctor on a daily basis. It was only after going to my medical college and then doing my internship. And if you ask me about some specialities, I probably still don't know, unless I don't spend as many hours in the hospital. A corporate setup is different, a government setup is different. You really don't know what the ground reality is. So these kids, just are, carried away with the idea and, with all the glamour of the white coat and the stealth and the scrubs, and that's why they want to do it. But if you want to do it for all these things, okay, fine. I get it. Everyone wants a status in the society, but it's not going to really take you long, and you will eventually lose the motivation. So ideally, I feel that everyone who decides to be a doctor, they should first talk to a doctor and not hear them rant about how difficult their profession is. They should rather just ask them, so what exactly happens on a day-to-day basis. So a doctor is going to tell you, a physician is going to tell you, I first see OPD of 200, say 200 people, then I go see patients in the ward, then I have to fill in their discharges, I have to sign in documents, and if I'm on call, then my phone is ringing all day. So if you are in it, if you are up for all this, and then they also have to tell you that I can be called at any hour in the hospital, and the kind of interventions you're supposed to do, what exactly a medical doctor does, for example, a pleural tap, an ascitic tap, whatever. So that will, probably put things a little more into perspective, that this is what a day-to-day life of a doctor is, rather than just, looking at the glamorous part, okay, they come under the academic leads. It's just not about that. So I tell those kids, why do you want to be a doctor? So many of them have very standard answers. हमारे घर में सारे doctor हैं. Or then they say like हमें पैसा कमाना है. And few of them say like कि और कुछ option नहीं पता है. And then few of them say that that they really like the idea of healing people because they are motivated by House MD and Good Doctor. These two particular series are made in Western settings. My kids, and these are all dramatized, and this is not the stark reality of being a doctor in a country like India. It is just the opposite. So please don't get carried away by that. The picture is all glossy on the outside, but there is so much more to it. So then I asked them, okay, is this the case? Then if this is the case, then this is what you should do. Then this is the case. Then I ask them a few questions, and then I tell them this is how my day is like. That is why there are so many blogs on YouTube wherein doctors from almost all countries and different specialities make blogs like one day in day of a doctor, or whatever. So if those things, if you're okay going to wards and giving patients fluids, checking their BP, their heart rate, their respiratory rate, and prescribing medicines, if that's something you want to do for all your life, then welcome. This is the field for you. And it's not going to be all happy and merry. But I can say one thing, that there is nothing more satisfying. It's every day when I come back home, there is definitely going to be money in my bank account, because obviously I'm a skilled labor to this country, and every setup that I work in is supposed to pay me. But it is so satisfying to just realize that today I have helped these many people. I have relieved these many people's pain, physical pain, and I have probably just healed these many lives. This feeling is unparalleled. It just cannot be matched. When I was in my fourth term, so we used to have our labor room postings, and a lot of us used to bunk because we had a lot of academics to do then. But I, out of curiosity, went into the labor room, and doctors are always very welcoming when it comes to teaching students, because they know that we are going to be their future colleagues. So when I went into the labor room, and I had a very, very nice professor, and she told me that, would you like to assist? And I got, all excited, and that was the first baby that I delivered was dead, and it was a very complicated delivery. It was a preterm infant, and it was literally this small, and it came out, and I was really excited to see a human being, pop out of another human being for the ever first time. Obviously, I had read it, but that was my ever first encounter. And it wasn't as pleasant. The baby's heart was beating, but then since it was a preterm baby, obviously the viability is not there, so the babies went off, and the gynecologist picked up the baby and put the baby in a kidney tray. And I was like, wait, this was supposed to go on the pediatric tray. What did just happen? And I was I literally was so traumatized that day, and it really took me a lot of time to process it. And then I regularly started going to the labor room, and then I got used to it. Then it was fun, and the ever first live baby that I delivered, it was such an event for me. It was so beautiful to see a to hold a human life and come out of another, and it's a very amazing event. So these kind of feelings, I feel that no other profession is going to give you. If money gives you happiness, then corporate is your place. If science is something which, if not biological science, mathematical science, then engineering is your place. But here you are going to be dealing with such things that the stakes of everything are so high that there is a very less margin of error. There is literally a very less margin of error. May it be any setting. It is said that doctors and government can commit mistakes. No, they can't, because you're dealing with lives. The setup might spare you, but how will you go to bed? Will you be able to go to bed with the guilt that you screwed up someone's life? I'm sure not. I'm not trying to scare you here, but I'm just not trying to paint a rosy picture. It is that the stakes are going to be really high, but it is going to be very satisfying. If you're able to revive someone who's about to crash, then resuscitating that patient and bringing that patient back to life is just such a wholesome feeling that I cannot even put it to words. I'm so sorry, Target Medical, I cannot put it to words, but it's just really amazing. Apart from that, I was asked to share some tips and tricks. Okay, I would like to tell you something about brief about my medical college. MBBS is like, it's the foundation of all the rest of your years as a doctor. You read 19 subjects, medical and surgical and allied specialties. And now, after the amendment of the curriculum which came in 2019, I think you guys are also supposed to read computer sciences and yoga, which I feel is good. And you will be in touch with the clinics. You will be in touch with the clinics at a more early stage. That is also very nice. Very nice. So the curriculum is going to be like that. But it was hours and hours of studying 2 months before my university exams, and days of studying before my term exams, which is like which are like semester. There's no semester per se. The MBBS is divided into total 4 profs: Prof 1, Prof 2, third Prof Part 1 and 2. So second Prof is the longest, and then in the third Prof Part 1 and Part 2, because you read clinical subjects, basically the subjects that you practice in a hospital. Then in the second Prof you read paraclinical subjects, that subjects through which the clinical departments, the patient-oriented departments run, like pathology, microbiology, forensic medicine. And in the first year, you read the preclinical subjects, which lays the foundation stone of understanding the basic biology of a human body, which is anatomy, physiology, and biochemistry. So you read all that, and my first, I think all of you must have watched Munna Bhai MBBS. So since I told you I did not have any doctor in my family, so I was very excited to attend my ever first dissection. So I go into the dissection hall, and my parents were ready that they're going to get a call from the anatomy department that your daughter has fainted, kindly come and pick her up. But not the case. It was so hilarious that my college is one of the colleges which doesn't get unidentified bodies for dissection, but it gets donated bodies. So the advantage of having donated bodies in the college is that you can preserve them properly. And when we open it, we get to see the intact anatomy of that particular part. So that enhances our learning. And then Leela Seth's body was donated to my college. And and also one more celebrity which we are not supposed to name, and I dissected on that body. So the dissection tables were dissection tables, and we were 10 people per body, which is like a very good ratio. And they were all covered, and then we were asked to pray and thank the souls of those bodies for donating them to us so that we can learn. because today if I'm a doctor, without passing anatomy I won't be one. So we thank the souls, we start with the puja, and then we are just waiting for the bodies to be uncovered. And the first day we were just told to acclimatize to the smell of formalin and phenoxymethanol, and looking at the anatomy, all human body parts and bones and soft parts and hard parts displayed around us. And there were lab assistants who were standing on every table, and they uncovered the body. And the moment they did that, we heard two loud noises of someone falling. Like 2 people had fallen. So everyone just thought it's going to be a girl, obviously. And then we turned back, and since my name starts from A, I was on the first table. We turned back, it was 2 guys who fell, and it was so hilarious. Sorry for the sexism here. But it was quite an experience. Like, I loved anatomy, I loved cutting the body. It was so beautiful from the inside. What a piece of art the human body is. I was really mesmerized by the science which God has. That was one very memorable experience. Then there is I'll tell you about all subjects. Then there is physiology, basically how the human body normally works. So there is one experiment in physiology which we are supposed to do. It's a part of our practicals, wherein you're supposed to estimate your own hemoglobin, but not using, obviously, when you go to a pathologist, then it's an automated report you get. You're supposed to do it by spreading your blood on the slide and examine it under the microscope. And then that's how you see how the blood picture looks. And then there is something called a Sally's test. A Sally's test is a test through which you see how much hemoglobin you have. You dilute it and then you see it, whatever. The point is that you have to have your own blood sample for doing that experiment. So we used to take a lancet, and we used to prick each other. We used to prick us and then take our own blood out. I did not really get the logic of this. I was like, why? Why can they just not get us borrowed blood from the hospital? There are so many blood samples there, and then we could just use it. So we were told that you're supposed to feel the pain that the patient goes through when you prick the patient, but that was all nonsense. That was just make us to do. So I used to be so drowsy and hypoglycemic, or at the time of experiments, I would always skip my breakfast running late for college, that I always had to borrow blood. So yeah, I used to borrow blood for doing all those experiments. I think I have already crossed the limit. It's 26. I didn't really wanted to make it this big, but I'll just brief up the thing. So after I finished my MBBS, in the course of my MBBS, I came to know about something called research. Indian Council of Medical Research gives STS, short-term studentships, to students who want to do research, and I was interested in science. 3rd year is the year which is like really chill. So I thought, okay, might as well just take up a research project. So a 3rd year kid took up a research project in neurology, and I used to work with my consultant in neurology. We worked on seizures, and that paper got published that year itself. Like, as an undergrad, having a paper published is not something which is very common. So I got my ever first publication in my 3rd year itself. I started the research in February, and my paper was published in around October or something. Generally this doesn't happen this fast. So that's how I was introduced to research, and I started after that. In the year next, I presented that research at multiple platforms, national and international, and getting so much recognition from such amazing doctors who are doing such extensive and such important and quality research was something to look at. Like, literally research on the subcellular level and their clinical manifestations of that. So it was really amazing. There is a conference in Europe which happens every year. It is for all, and it's one of the largest, and I went there and I won multiple awards there for my presentation of my paper. So that was something. It was quite an experience, and it was not all fun and games, right? But I also learned how to write a paper, how to interact with patients when it comes to collecting the data for my paper. And since I used to be sitting in OPD for hours and hours, I learned most of the neurology through that. So that was fun. And in my 2nd year, which is like the most lamba year, I used to do a lot of co-curricular activities. If you think there is no scope, then I'm sorry. There is a lot of scope of doing co-curricular activities. I was in the music club, I was in the literary club, I was always, I was either emceeing, and I was doing slam poetry, I was writing poems, I was writing articles, I was dancing, I was also in the dance club, I was dancing, I used to be singing, I used to be giving band performances, and and I have earned a lot of accolades for my college in multiple fests in co-curriculars, and so that's why every time I used to go for a fest which used to be in my lecture hours, I used to get an attendance for that, because obviously they used to be like, if this girl has gone, then we'll definitely get a prize. But it was only good for till my second year, because then in my third year when I started going to fests, it was all kids coming there, so I used to feel a little old. So that's why I took up the research thing. And then in my final year, for 2 months, I was in Europe. Correction, for 20 days I was in Europe, for my conference, which was completely funded. I had gone on scholarship. I had to sit through multiple rounds of interview to get a scholarship, because it's not easy to get one, and I somehow managed. And I also went as a visiting Indian student to World Health Organization, like the Supreme, and I went and saw the headquarters in Geneva, Switzerland, and it was quite an experience. So all in all, my entire MBBS journey has been the foundation stone of the kind of, more than the kind of doctor, the kind of person I want to be in my life. But the confusion never really ends. And then the internship started. Internship is hours of night duties, hours of OPDs, and multiple number of Foley's, which is basically a catheter which you insert for urination for bedridden patients, number of vials, which is a feeding tube, and number of blood sampling. That's what an intern is supposed to do in few of the departments. But internship was the time I realized that how much I loved doing what I do. I loved staying in the hospital and interacting with patients, learning from my professors, learning different radiological techniques. One experience that I would also like to share from my internship is that I was on a duty, and it was 3 a.m. and the doctor on call was attending some other call, and my nurse told me that there's this one patient who's come with urticaria. Urticaria is basically that you have some eruptions on your body, and she was a 3rd trimester pregnant patient, and she was sitting, and we were giving her the drug which should resolve urticaria. So she was sitting, we were administrating the drug, and all of a sudden my patient just went unconscious. And I was an intern, like an intern has a very limited knowledge. I was like, okay, what just happened? So we started running fluids, because the BP just dropped. And we started running fluids, and I was like, okay, now this will pick up, If we could not get the BP back on time, then it will lead to hyperperfusion. It could have affected the fetus, the child also inside. So so that's why I feel that reading in a field is very, very important. I had recently been studying obs and gynae for my entrance exam. So there is something called an IVC syndrome, compression syndrome. Basically, the great vessels in our body, they run in the midline. So it was compressed it gets compressed if you sit like this when you're pregnant. And that reduces the circulation, so that's why you get the blood pressure drops down. So all you have to do is you just have to put the patient in the left lateral position. So let's say left में रख देना, that's just left में जैसे सोते हैं. So I just put the patient in the left lateral position, and her BP just picked up, and it was such an adrenaline rush. And my MO was so impressed, and my nurse was so impressed, because they were all just trying their ways and means, and this one intern comes and she saves the patient and the child. And it was I think this is the most memorable incident that I had in my internship. I came home so happy that day, and I told my parents about it, and they were also very happy. But during my internship, there was COVID, and we had to miss a few of our postings because the surgical departments were shut. And the pandemic probably by now has mellowed down, but the wounds which it has left on people and on families, they're still there. I have so many colleagues, seniors and juniors, who volunteered at that time to work on the front lines. I was infected, so I could not initially. Who now have developed lung pathologies like fibrosis, and they are like affected for life. And I don't think that people are grateful enough for that. Like they have literally risked one part of their body just to save yours. So you need to get used to non-thankful people coming to you. And secondly, what all I could do was during the COVID time was that I was myself stricken with COVID during the second wave. So during the first wave, I was just an intern. During the second wave, I myself had COVID. So I was giving out free consultations to COVID patients. I was doing live videos and spreading as much awareness with my knowledge as I could. So that was quite a wholesome experience. So all in all, hostel life is too much fun. You learn, interact, you do things together. You make some friends which last forever, and then also you may not make friends. You really learn to be a holistic person. So that's what medicine does to you. You can face any challenge in your life, I feel, and nothing is going to deter you. It's going to be a little mentally challenging, and it's going to be hours of studying, but in the end, it's all worth it. My Instagram handle, my Twitter handle, and my Facebook profile is dropped down here in the link description. If you guys want to contact me for anything, I would be very happy to answer your queries. And my Instagram handle is api.priyadarshini. So follow me on Instagram, and I keep on uploading educational videos, informative things, and a lot of avenues which come by for students, juniors that I know of. So that might again help you. All the very best. You have signed up for something which is so noble, and it's going to be very, very satisfying. It was great talking. Thank you, Target Medical, for giving me this opportunity to share my journey.